Stop wasting time on fake pills and dangerous procedures. If you've ever wondered, can I actually make my penis longer? This video will give you real science-backed answers. No fluff, no gimmicks, just cold hard facts from medical research. Let's dive into the truth about penile lengthening. Most men who worry about their penis size fall within the normal range, yet the obsession persists due to unrealistic expectations fueled by media, social pressure, and misinformation. Scientific research shows the average erect length is 5.2 inches, 13.2 centimeters, while anything over 2.9 inches, 7.5 centimeters is considered medically normal. Despite this, a large number of men experience small penis anxiety, a psychological condition where the perception of inadequacy leads to distress, avoidance of intimacy, and even self-destructive behavior. Penile lengthening methods fall into two main categories: non-surgical and surgical. Among non-surgical options, penile traction devices, PTDs, are the only methods scientifically proven to provide measurable results. These devices use mechanical stretching to gradually encourage tissue expansion, similar to how body modifications such as earlobe stretching or orthopedic limb lengthening work. Studies show that with consistent use, several hours daily for months, men can gain up to 0.8 inches, 2 centimeters in flaccid and stretched length. However, these results require dedication, patience, and proper usage to avoid complications like numbness, bruising, or lack of efficacy. Vacuum erection devices, often marketed as a means to increase size, do not result in permanent length enhancement. They function by drawing blood into the penis, creating temporary swelling, but once the effect fades, size returns to its baseline. While useful for erectile dysfunction, they hold no value in actual enlargement. Penile injections, including fat transfers, dermal fillers, or silicone implants, pose significant risks and are not recommended. While they may temporarily increase girth, they do not contribute to length and often lead to complications such as lumps, deformities, infections, and in severe cases, permanent erectile dysfunction. Some reported complications have arisen even decades after the initial procedure, making these treatments highly dangerous. Surgical options exist, but come with substantial risks. The most common procedure is suspensory ligament release, which involves cutting the ligament that anchors the penis to the pubic bone, allowing more of its internal portion to become visible. While this may result in a gain of 0.5 to 1 inch, 1.3 to 2.5 centimeters, it can negatively impact erection angle and stability. The penis may no longer point upward when erect, potentially reducing functionality. Additionally, to maintain any gains, patients must follow a strict post-surgery stretching regimen. Otherwise, scar tissue may retract the penis, leading to a net loss in length. Other surgical interventions, including grafts, fat injections, and synthetic implants, have largely been unsuccessful. The outcomes are often unpredictable, satisfaction rates are low, and complications such as asymmetry, tissue necrosis, or loss of sensation are common. Due to these risks, major urological organizations do not endorse surgical enlargement unless it is part of a regulated clinical trial where safety and efficacy can be monitored. Psychological intervention remains one of the most effective approaches for men struggling with small penis anxiety. Cognitive behavioral therapy, CBT, has been shown to significantly reduce distress, helping individuals develop a healthier perception of their bodies and addressing underlying insecurities. In fact, many men who undergo therapy no longer feel the need for lengthening treatments afterward. The reality is that most concerns over penile size are not rooted in anatomical inadequacy, but in comparison and self-perception. Research confirms that sexual satisfaction is more dependent on confidence, communication, and skill rather than size. Women overwhelmingly report that factors such as emotional connection, technique, and arousal play a far greater role in pleasure than mere dimensions. For those still seeking enlargement, penile traction therapy is the safest and most effective method. Surgery should be considered only as a last resort due to its high complication rate and unpredictable results. Above all, addressing psychological concerns is often the most transformative approach, as confidence is ultimately the most attractive quality a man can possess.